I will be talking about in the upcoming 20 minutes about the insulin patch, equal insulin patch, which is available in Bahrain, tubeless insulin patch. So everybody knows how is the burden of type 1 diabetes. They need to take multiple different actions on the same time. How difficult is to the control type 1 diabetes with MDI and the evidence behind with insulin pumps to control diabetes. So what is the importance of insulin pump technology? If we compare the MDI to the insulin pumps, when insulin is deposited in the subcutaneous tissue by the insulin injections, it will be accumulated in the fat subcutaneously, and the absorption is unpredictable. It will be associated with hyperglycemia or hypoglycemia, especially at the long term, and with the development of lipohypertrophy, the absorption will be delayed, associated with post-meals hyperglycemia and delayed hypoglycemia, as you know. So there will be glycemic variability, and the glycemic variability is highly associated with harms and cardiovascular impact on patients with type 1 diabetes. So, however, the insulin pump, it will deliver insulin in micro doses, very small, continuously, avoiding the depot and formation of the lipohypertrophy, will give us consistent absorption, mimicking the normal pancreas. So as you see, comparing to MDI, patients on MDI, they will have high glycemic variability, hyperglycemic excursions, and hypoglycemia. Compared to the insulin pump, they will have a tight time and range and glycemic control better than the MDI, avoiding the hyper and hypoglycemia excursions. So the equal pump is a patch pump, tubeless, consists of a patch, as you see, and a PDA, which we don't have here previously in Bahrain, and we have a lot of patients with type 1 diabetes who are refusing the insulin pumps only because of the tubes and the difficulty. They feel embarrassed, non-practical. So the patch pump is one of the features that attack those patients. The characteristic of the equal pump, it is patch, tubeless, small and light, and it consists of two batteries, rechargeable, tubeless as we said. It is integrated with a CGM Linux, user-friendly, very easy to use for the healthcare providers and for the patients, and it is affordable. We can increase the insulin delivery precisely for about less than 0.025 per hour. So what are the features of the equal pump? You will decrease the number of injections that the patients received every day, and we will need to change the infusion set every 3 days. It's easy and painless. Also, the healthcare provider can program a pre-programmed insulin delivery programs, up to 7 programs. Each program can have 48 basal segments. So you can put a basal rate every half an hour, every day, and usually programmed by the healthcare provider. And also it has temporary basal feature and suspend feature. So you can use it, the patient with type 1 diabetes can use them during illnesses, during the menstrual period, during, for example, exercise and fasting. For the calculation of boluses, we program usually the active insulin time, the carb ratio, the target range, and the patient will enter the carbs, so it will calculate the doses for the meals and the corrections. As we said, it can give a small increment in insulin doses up to 0.025, different than the insulin pens, which only we can increase by 1 unit per injections. By evidence, equal pump users demonstrate lower hypoglycemic events, lower hyperglycemic events, and better time and range. Also, they have less skin complications and better quality of life, and they are they have more satisfaction. The system components are the pump, the PDA, where we programmed the insulin delivery, the ratios, and the settings. And the patient can enter and control the pump by the PDA, the cannula, the reservoir, and the inserter. These are the insertion site: upper limb, abdomen, back, thighs, and buttocks. And the installation steps consist of insertion of the infusion set, which is the patch, and the cannula. Then we fill the reservoir with insulin, the rapid insulin, for example, the Novorapid, and we insert the pump on the infusion set. What is the evidence about the equal pump? So this trial was held by Dr. Ayman Al-Hayek in Saudi Arabia and Riyadh, and to study the efficacy of equal patch pump therapy in patients with type 1 diabetes. So it includes 47 participants with type 1 diabetes and over a 6-month period. And it showed a significant reduction in HbA1c, fewer hypoglycemia and hyperglycemia, and high levels of satisfactions were reported. So why will we choose equal patch pump? Because it gives consistent, accurate insulin delivery, avoiding hyperglycemia and hypoglycemia and glycemic variability. It improved the glycemic control, improved hemoglobin A1c, decreased the hypoglycemia and hyperglycemic events, and improved the quality of life. Also, it is affordable, and as we know, the company has a support team for people who are using the insulin pump. As we know, ages in Bahrain, and everybody, I think, our healthcare provider experience how supportive is the ages team and using the sensors, Linux sensor. And also, they have a support team to improve the technology in the Microtech company. And they have also, the previous pump I was talking about is an open loop. However, there is an upgrade of the insulin pump to the closed loop. So we have closed loop and the patch. However, it's still not available in Bahrain, and it soon will be available, inshallah. So for patients and healthcare providers, the pump is, we have the pump and the patch pump and the pad. Also, it is connected wirelessly with the app. And for the healthcare provider, it's connected to the platform, so the healthcare provider can read and see the readings of their patients. It's named PenCares. And for example, this is how it looks in hospitals. They are using it in the inpatient for patients with diabetes, and the healthcare providers can have a look at the readings of the patient in the hospital. And thank you.